Good afternoon, Professor Raj, and everyone. Thank you for making the time to listening to AstraZeneca group case. My name is Jonathan, and I'm here with Dinandra, Yitong, Dendri, and also Johan. Today we will talk about AstraZeneca global strategy overview, and also how about the business and the risk, the strategy pillar that use to running on the business, and also in the end we will do recommendation for the peer group, whether they should invest in AstraZeneca or Bayer. First of all, AstraZeneca is a global science-led biopharmaceutical company that focus more on prescription medicines across key therapies such as oncology, cardiovascular, and also rare diseases. The strategy is centered on driving innovation that lead to growth worldwide with ambitious targets such as nearly doubling revenue to $80 billion and launching 20 new medicine by 2030. AstraZeneca is defined by several key strategic pillars that guide its development on operation globally. One of the example, AstraZeneca rapidly advances an industry-leading pipeline that currently they have 200 projects in development that aim at delivering the next generation of medicine across its therapy area. And then partnership are central to AstraZeneca strategy, both for pipeline innovation and for expanding its global reach. AstraZeneca actively collaborates with biotech companies, academic institutions, and industry peers to supplement its internal R&D. One of the example, AstraZeneca has major co-development and licensing deals to enhance its business. For example, it has partnered with Japan Daiichi Sankyo to develop novel cancer. So in 2023, they received approval in Japan for Datroway in metastatic breast cancer to treat breast cancer. It shows the partnership accelerate AstraZeneca ability to bring new medicine to market. And also we know that AstraZeneca has collaboration with Oxford University for the COVID-19 vaccine in 2020. Pass over to Johan.
Thank you, Jonathan. So now we are moving on to the three strategic risk. And then the first one is strategic risk. Number one, R&D pipeline and innovation risk. Can you please move to next slide? Okay, this first risk is related to AstraZeneca's R&D pipeline. The risk lies in failing to deliver new products and securing regulatory approvals. The downside is that failed clinical trials or regulatory rejections could delay launches and cause major revenue loss. But on the upside, if AstraZeneca successfully manages its pipeline and regulatory compliance, it can accelerate product launches, reinforce its scientific leadership, and achieve its $80 billion revenue goal by 2030. Next, please. And then the second risk is market competition and access risk. So AstraZeneca faces intense pricing pressure and competitions, especially with the new Medicare pricing cuts. The downside is higher costs and potential loss of first-mover advantage, particularly in emerging markets. And the upside, if AstraZeneca effectively brings its 20 new medicines to market, it can capture first-mover advantage in many indications and strengthen its market leadership. And then moving on to the next slide, the third is supply chain and operational resilience risk. AstraZeneca must prevent disruption in manufacturing logistics. The downside is that delays, reputation damage, and recent tariff pressures could increase supply chain costs and slow global operation. But the upside is, if AstraZeneca strengthens its supply chains, it can ensure reliable delivery, build patient trust, and sustain revenue continuity.
So, to mitigate the risk of R&D failure, the first mitigation that we propose is early stage collaboration group. So, as Jonathan mentioned before, AstraZeneca has actually a strong experience in building research partnership. However, there is an opportunity to deepen collaboration earlier in the development process, especially for complex areas like oncology. So this is to expand open and early stage collaboration with academic institutions and research consortia. And then this approach will allow faster learning, shared research costs, and also reduce early stage risk before moving into competitive product development. However, some collaboration may still result in research dead ends, and there's also a chance that other members act faster on shared findings, but this risk can be managed through clear boundaries and also focus areas. Next, the second mitigation that we propose is strategic partnership with healthcare partners to mitigate the risk of pricing pressure and also limited market access. So AstraZeneca has taken steps toward value-based pricing, and there's opportunity to build on that momentum. So this will strengthen a partnership with like Medicare and private insurers through value-based contracts, including pay-for-performance models, tiered pricing, and also bundled payments. This will improve patient access, align payments with real-world outcomes, and also strengthen trust with payers. So it will shift like the focus from cost delivered to value delivered. However, real-world outcomes may differ from the clinical trials, and there's also tracking effectiveness. Effectiveness will like adds to complexity, so it will need like careful planning and also data alignment for this mitigation. And then the third solution, next, is to apply dynamic production capacity to address the risk of supply chain and operational disruptions. Since AstraZeneca has a robust global manufacturing network and there's a chance to enhance its flexibility and responsiveness, so to adopt dynamic production capacity tools using real-time data and simulation to adjust schedules based on demand, material supply, and also equipment availability. Thank you. Next.
Yitong.
Oh, okay. Thank you, Dinandra. And let's move on the common strategy risk that faced by both AstraZeneca and Bayer AG, which is the risk of loss exclusivity. And this is a common risk that existing in pharmaceutical industry, and it happens when patent of company's key drugs expired, and that will allow generic competitors to enter the market. As a result, both companies face significant revenue declines. As generic company erode the market share and of their key drugs. The reason that this risk matters is because these revenue drops will directly impact their financial stability and market share. They have to address this risk proactively to maintain their market position and profit margin. Next slide, please. The way that both companies to mitigate this risk is different. Starting with AstraZeneca, their approach is heavily centered on pharmaceutical innovations. They focus on developing new medicines to replace those losing patents, which can ensure a steady pipeline of launching new products with patent protection to generate a higher profit margin. They also leverage strategic partnership to bolster their pipeline by using external expertise and innovation. While Bayer AG chose a more diversified strategy, they invest in innovations across multiple sectors from pharmaceutical, crop science, and consumer health. So they mitigate risk by creating a broader business portfolio. Additionally, Bayer emphasizes on sustainability initiatives to realize the long-term development in the market. So in conclusion, AstraZeneca focused on pharmaceutical growth with aggressive revenue ambitions, while Bayer balances its efforts across diverse divisions with a focus on sustainability.
Thank you. The SWOT analysis compares AstraZeneca and Bayer's highlighting key strategy factors. The AstraZeneca strengths lie into focus on the pharmaceutical R&D and clear revenue goals. However, it faces risk from uncertain R&D returns and heavy reliance on the US market. And for some geopolitical reasons, especially in China, opportunities include the strong drug pipeline and international expansion. On the other hand, Bayer boasts a more diversified portfolio and advanced biotech investment, and it also has a strong global partnership, but it's weighed down by the legal issues related to glyphosate and rooted in emerging market health innovation and strategic alliance. Next is the strategic Porter's analysis, Porter's 5. The Porter 5 analysis outlined competitive dynamics facing AstraZeneca and Bayer's. For the supplier, power remains moderate for both companies as it relies on specialized resource and tight active pharmaceutical ingredients and biotech inputs. In terms of biopower, AstraZeneca faces high pressure from governments and healthcare system negative for pricings. The threat of substitution for both is relatively high, with patent expiration leading to generic and biosimilar alternatives. Lastly, for industrial refinery, it remains intense in both cases with strong competition from global pharmaceutical companies. And then lastly, the pastel analysis highlights the AstraZeneca and Bayer politically both face significant regulatory oversights, and economically both are vulnerable to inflation and cost volatility and also currency risk. Technologically, AstraZeneca advances in digital health and R&D, while Bayer innovates into precision agriculture and AI. Lastly, for the environmental, both firms are under pressure to improve sustainability, and AstraZeneca has committed to carbon reduction, and Bayer still facing just scrutiny.
Okay, thank you, Dendri. So the last question, which one we recommend to invest for the PRA group? AstraZeneca is the clear winner over Bayer. AstraZeneca has a focused innovation-driven strategy with a goal to reach $80 billion in revenue by 2030 and launch 20 new medicines. It operates in over 80 countries, executes consistently across global markets, and has a strong record of delivering results. It up to 21% in revenue last year alone. So on the other hand, Bayer is stretched thin across pharma, consumer health, and agriculture, and it's still recovering from a high-risk Monsanto acquisition that burdened Bayer by 36 billion euro in debt and ongoing litigation. While Bayer is in turnaround phase, AstraZeneca is already outperforming with a disciplined execution and a high-growth pipeline. For a lower risk, high potential investment, we recommend to invest in AstraZeneca. So these are all different. That's all from our presentation. Thank you. Wait, let me first.